The world is going through an unprecedented public health crisis due to coronavirus. My name is Willem van Schaik. I'm Professor of Microbiology and Infection at the University of Birmingham. So first of all, I want to talk to you about why the coronavirus is so serious. This is a disease that spreads very easily from person to person. So far, it looks like the mortality rate of this disease is quite low, around 1%, but that can go higher if the healthcare system breaks down. And then we no longer have the ICU beds to take care of patients that are critically ill. Even particularly older people are at risk of coronavirus, but also younger people can get very serious disease. So the virus infects us by when we breathe in aerosols. So those are small particles that are floating around in the air. Or if we touch surfaces on which the virus has landed and then touch our face. The virus will then enter the lungs and there it will start replicating. And by replicating, it will destroy the cells in the lungs and that will cause a pneumonia, which is a very serious condition. So currently there's already an unprecedented amount of research going on into coronavirus. We understand a lot about how it spreads and how it has emerged in China in late 2019 and how it has since spread across the planet. We also know how it infects cells. However, we still do not have a drug or a vaccine against coronavirus, and many groups across the world are working on this topic right now. However, it's not realistic to think that we will have a vaccine or a drug against coronavirus in the very near future. And so that's why we need to all protect ourselves against the virus. And we can protect ourselves by, for example, washing our hands on a very regular basis. For example, if you just came into work, or if you just left work, or if you come into a house and if you've left house, and even if you've just touched your face. We can also help to protect ourselves and the people around us, that if we cough or sneeze, that we catch that in a tissue, or if you don't have a tissue at hand, cough in your elbow. There are many myths going around regarding coronavirus, and one of them is that you might be able to kill it by gargling disinfectant. Unfortunately, this is not true, and gargling with disinfectants might even damage your health. Because the virus resides in the lungs, you will not kill it by gargling with disinfectants, because the disinfectants will, fortunately, not reach your lungs.